My name is Shelby, and I'm going to be doing a physical assessment today. I'm reminding my patient of his right to confidentiality and privacy. The first thing we're going to do is start with his face. So I'm just going to be inspecting, looking at it for any abnormalities, and then I'm going to inspect and palpate his cranium for any kind of abnormalities. Don't feel anything. I'm going to be looking at his face and the symmetricalness, the symmetry of it, and then I'm going to palpate his temporal arteries, making sure that we've got a good pulse. He's got a very good pulse. All right, next thing we're going to do is palpate his temporal mandibular joint. So I'm going to hold his jaw like this, and he's going to open and shut his mouth. I don't feel any kind of popping or cracking or anything. Did you have any pain? Okay, so that's good. The next thing we're going to do is his cranial nerves. The first thing we're going to do is get a tongue blade. I'm going to get him to bite down on it. Bite. No, bite. I'm going to pull. Good. All right, next thing I'm going to do is to look in his mouth, test his gag reflex. Okay. I'm going to look around in there, look for any kind of ulcerations or discolorations, and everything looks normal. All right. I'm going to get you to smile. Can you frown? Can you show me your teeth? Can you puff up your cheeks? Can you squeeze your eyes tight? All right, good. So all those cranial nerves are intact. And then the next thing I'm going to do is whisk a cotton ball on his cheek. Can you feel that? Can you feel that? So that cranial nerve is intact. All right, and now I'm going to get him to read off the Snellen chart to check his eyes and his vision. So can you read that first line for me?
C.
And the second line?
BR.
Third line?
QESW.
And then the fourth line?
MXOTH.
Very good. So he can see all that. All right, next thing I'm going to do is check his extraocular movements. So I'm going to get you to keep your facing this way. Don't move your head. I'm going to get you just to move your eyes to where my fingers are. So here, 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 here. Okay. And then I'm going to bring my finger closer to you, and I don't want you to move your head, just move your eyes, and tell me when you stop seeing my finger. Okay, good. All right, now I'm going to be looking at his pupils. Very good. They're very reactive, brisk, very good. All right, and they're very equal. So the next thing that we're going to do is I'm just going to look at his eye structures. I'm going to be looking at his eyelid and his eyebrows, palpating any pain. His lashes are intact. All right, and then the next thing we're going to do is look at his external ear. So there's no kind of malformations or anything, any pain. Okay, all right. The next thing we're going to do is do the whisper test. So I'm going to whisper into his ear, and he's going to repeat back what I say. So, all right, ready?
Apple.
Okay.
Baseball.
All right, good. So he can hear very well. All right, the next thing I'm going to do is get you to occlude one side of your nose and sniff out of the other. All right, and the same thing with the other side. Okay. All right, now I'm going to palpate his maxillary and his sinus nodes. Any pain when I'm pushing? They're not swollen or anything. I can't feel them. Next thing I'm going to do is do range of motion. So first thing we're going to do is touch your chin to your chest. All right, can you turn your head side to side? Well, pick your head up. Turn side to side. All right, and I'm going to get you to touch your ears to each shoulder. All right, and I want you to extend your head all the way back. And then I'm going to get you to lift your shoulders while I'm pushing on them. All right, lift your shoulders up. Very good. So he can do that against resistance. All right. The next thing I'm going to do is palpate his trachea and his thyroid. So just Alright, can I take you to deep swallow some spit? One more time. Okay, very good. Alright, and let me look in your mouth one more time. I'm gonna look at your tonsils. He does still have his tonsils. Stick your tongue all the way out and say, ah. Alright, good. Let's see. Next thing we're going to do is check his carotid pulse. So we'll check one each side. Don't ever check them at the same time. That pulse is very strong. And then this pulse is strong. And then we're going to osculate for any bruits in his carotid artery. No bruits. All right, I'm going to inspect his conjunctiva, his sclera, the cornea, and his iris. Okay. I'm going to be looking for any kind of abnormalities. Everything looks normal. Everything looks good. Now I'm going to palpate his lymph nodes. Just let me know if you have any kind of pain. Any pain? All right. Okay, now we're going to be looking at his chest wall. I'm going to look for any kind of abnormalities or anything. I'm going to get him to take a deep breath. And he's got equal rise and fall in his chest. All right, now we're going to check for tactile primitus. I'm going to place my hands on his chest and get him to say 99. I'm going to make sure that the chest wall is vibrating. So
99, 99, 99.
And I'll do it from the back. Okay.
99, 99, 99.
Very good. So it does vibrate in all his chest walls. All right, now I'm going to percuss his lung fields. So just breathe normally. No pain or anything, right? Okay. Now I'm going to do it from the back side. Any pain?
No.
Now I'm going to listen to lung sounds in the front and back. Take some deep breaths. All right, we'll do the same thing on the back side. Very good. Now I'm going to percuss his costovertebral angle and make sure that there's no tenderness or anything. So I'm going to hit you and you tell me if it hurts, okay? Ready? Any pain?
No.
Okay, so he doesn't have any kind of pain or anything. Now, his chest wall doesn't have any kind of abnormalities or anything. So now I'm going to listen to his heart sounds. Very good. All right, now I'm going to be looking at his arms. So you can put your shirt back on if you want to. I'll be looking at his arms and checking for any kind of moles or discolorations or anything that may be abnormal that need to be checked out. I'll also be checking his pulses and make sure he's got a good capillary refill. So I don't see any kind of abnormalities. He's got a few moles, but none of them are raised or anything. So I'm going to be checking his pulses. He's got a very good radial pulse, a good ulnar pulse, and a good brachial pulse. I'm going to check his capillary refill in this hand. Very good. All right, same thing on this side. Good radial, good ulnar, good brachial, and then good capillary refill. All right. Now I'm going to get him to do some range of motion exercises. So I'm going to get him to flex his arms above his head. All right, and then hyperextend them back behind your back. All right, and then I want you to abduct and adduct your arms. So here and away from you. Any pain, any trouble doing those movements? Okay, very good. All right, next thing, we're going to flex and extend our elbows. So here and here. Let me know if you have any pain. So stick your arms out like this and this. Very good. All right, so now I'm going to get you to do that against resistance. So I'm going to hold your arms and you're going to try to flex it towards your body like you did. Very good. So he can do it against resistance. All right. Let's see. Now we're going to do the same thing kind of with your wrist. So flex and extend your wrist. Any kind of pain? All right, so we'll hyperextend wrist all the way back. Very good. All right, make a fist with both your hands. All right, open your fingers, spread them like this, back and forth. Good. All right, now I want you to touch each one of your fingers to your thumbs. So, any trouble doing that? Okay, very good. All right, so next thing we'll do is I'm going to get you to take your finger and just move it to your nose. And on the other side. All right, very good. Now, I'm going to get you to close your eyes, and I'm going to draw something on your finger and on your hand, and I want you to tell me what it is, okay? And breathe. Very good, okay? I'm going to keep your eyes closed, and I'm going to hand you 3 objects, and I want you to tell me what you think they are. Okay?
Scissors.
All right. Last one.
Golf ball.
Very good. All right. Okay, now I'm going to be inspecting his abdomen. I'm going to pull up his shirt. All right, I'm looking and inspecting his skin. There's no discoloration. I don't see any kind of movement or pulsations or anything. It's very symmetrical. I don't see an umbilical hernia or anything. I'm going to now osculate his vowel sounds. And I'm going to osculate his aorta and his renal arteries. Everything sounds good. He's got good bowel sounds. Now I'm going to percuss his abdomen. And do some light palpation. Tell me if you've got any kind of pain. I don't feel any kind of abnormalities or masses. Now I'm going to do a little bit deeper palpation. No pain. Everything feels normal, looks normal. All right. Next thing I'm going to do is palpate his liver. Everything feels good. All right, now I'm going to be looking at his lower extremities. You can put your shirt down. I'm going to palpate his popliteal pulse. He's got really good popliteal pulses. All right, and then his dorsalis pedis. And his posterior tibial. And he's got really good strong pulses. All right. Now I'm going to get him to do some range of motion. So I'm going to get him to raise his knees 90 degrees. There you go. And do the other leg. And then I'm going to get you to bring your knee all the way up to your chest. Okay, and the other knee. All right, then I want you to kind of rotate your hips out. All right, other leg. And then rotate in. Other leg. All right, any pain? Okay, and then I want you to abduct and adduct your knees. So, just in and out. Sorry. And then the other leg as best you can. Alright, and then we're going to do some range of motion on your feet. So I want you to flex your feet in and out. And then side to side. Other foot. Okay. Now I'm going to place my hand here and I want you to try to pull your feet towards you. Okay. Like this. There you go. Alright, now push. Okay, good. His strength is good against resistance. Okay, now I'm going to get him to stand up. And then we're going to get you to run your heel down your shin. All right, and then do the other leg. And then I want you to kind of take some baby steps on your heels and baby steps on you there. Okay. All right, now, next thing we're going to do is I want you to stand still and put your arms out to the side. Close your eyes. Put your feet together. Arms out to the side. Close your eyes and just stand there. And see if how long you can stand there for just a couple minutes. It's called the Romberg test. Test your delivery. All right, that's pretty good. That's good. All right, next thing I want you to do is bend forward like this. All right, now I want you to go side to side. All right, and then you stand up, bend backwards, and I want you to rotate your shoulders like this. All right. I'm going to get you to bend forward one more time, and I'm going to check you for scoliosis as far down as you can go. Spine is good and straight. All right, last thing we're going to do is check his reflexes. So I'm going to get him to sit down. Sit down where your feet are hanging off. Like, scoot back. Okay, that's good. All right, I'm going to check your patellar reflex. I'm going to hit it and all right, very good. All right, now I'm going to check your Achilles. Okay. All right, I'm going to check your Babinski reflex. Okay. Now I'm going to get you to stand on one leg and hop. Very good. Now do the other leg. Okay, very good. Now this is the end of his physical assessment.